Today we discuss about the fifth disease. Fifth disease is a virus that causes a bright red rash to appear on the cheek. It is most commonly seen in school-age children. Fifth disease is a contagious and spread easily from person to person. However, once you are exposed to the virus, you are unlikely to get it again later in life. Fifth disease is not a serious medical condition and it goes away with little treatment. What is fifth disease? Fifth disease is a childhood disease that appears as a bright red rash on the cheek. It earned the nickname slave cheek disease because of this rash. Fifth disease is caused by a virus called parvovirus b19. This virus is very contagious and infected people can spread it through coughing or sneezing. Fifth disease got its name because it was the fifth viral rash disease known to affect children. The other viral rash diseases are grouped with include measles, rubella, German measles, chickenpox, rosella. It most cause fifth disease isn't a serious medical condition and it goes away with little treatment. How might get fifth disease? Anyone can get fifth disease, but it is most likely to happen in school-age children. Once you are exposed to the virus, your body immune system builds a defense to fight it off. This means that if you have fifth disease as a child, you will be immune to it as an adult. There are expectations to this immunity, but typically adults do not get fifth. What causes fifth disease? Fifth disease is caused by human parvovirus b19. It is a virus that spreads easily through droplets in saliva and nasal secretion. This means that it can be passed from one person to another through a sneeze or cough. This virus can also travel through a pregnant woman's blood to her unborn baby, but this is very rarely associated with a bad outcome. What are the symptoms of fifth disease? About 20% of people who get fifth disease don't have symptoms. Still, they can pass the virus to others. The disease often starts with flu-like symptoms. During these symptoms, the virus is most contagious. The main symptoms of fifth disease can include number 1, fatigue, number 2, headache, number 3, low-grade fever 99 to 101, foreign, runny nose, sore throat. It can take several days after the onset of flu-like symptoms for the raised slab-like rash to show up on the face or body. Once the rash appears, you are no longer contagious. The rash may be itchy. It should fade to 5 to 10 days. Some cause you may see a second rash that develops after the slave check rash. This time the rash may be located on the arm, legs, trunk, chest and back, buttocks. About 10% of children with fifth disease also experience joint pain and swelling. Fifth disease is much more common in children, but it can happen in adults. Adults who get fifth disease often develop flu-like symptoms without the rash. Along with those symptoms, about 20% of adults also develop joint pain in the wrist, hand and knees. How to fit disease diagnose. Few diseases are usually diagnosed based on your symptoms. The slave check rash is a strong sign of this condition, and when it is slave check by the other main flu-like symptom, your healthcare provider can usually diagnose few disease in the office without any other test. In rare case, your provider may order blood test to confirm fifth disease. What are the complications of fifth disease? Most people recover completely from fifth disease without any long lasting problem. Sometimes complications can occur including number 1, anemia. Sometimes the virus stops the body production of red blood cell leading to anemia. This problem is temporary and usually not noticeable. However, anemia can be serious if you have a weakened immune system. You are most at risk for complication if you have sickle cell disease, cancer, human immunodeficiency, have had organ transplant. Arthritis. A small number of children, 10%, and a large number of adults, around 80%, temporarily develop painful joint and swelling. These symptoms typically improve in a couple of weeks. However, 10% of adults develop chronic parvovirus associated arthritis or polyarthritis. Women are more at risk than men. How does fifth disease affect pregnancy? This virus can infect unborn baby through their mother's blood. The virus doesn't cause birth defect or developmental problem. If you are pregnant and have been exposed to someone with fifth disease, contact your healthcare provider immediately. If you have fifth disease while you are pregnant, the virus can very rarely lead to fetal anemia, low red blood cell count, and raw fetal fluid build up around organs, miscarriage when pregnancy and before the baby develops fully, stillbirth when a baby dies before birth. Our most pregnant mothers who are infected with this virus deliver normal, healthy babies. How can I prevent fifth disease? There isn't a vaccine to prevent fifth disease because the virus spreads easily through nasal and mouth droplet. Good hygiene is the best way to prevent that disease. You can reduce your family risk of infection by taking these steps: washing your hands frequently and thoroughly, sneezing or coughing into the crook of your elbow, avoiding close contact with an infected person. What should I call the doctor? Reach out to your healthcare provider if you think you have fifth disease or have been exposed to the virus. It is also a good idea to call your provider if you have severe joint pain, itchy, rashy pregnancy, weakened immune system, sickle cell anemia. Even though fifth disease can look intimidating with either distinct red rash, it is usually temporary condition that goes away with little treatment. However, it is important to understand that fifth disease can spread easily. If a member of your family has any of the symptoms of the condition, call your healthcare provider. You have need to keep your family member away from others for a little while to keep the disease from spreading. Unfortunately, it can spread before you have symptoms and can be passed along the other without your knowledge. Talk to your provider about the timing of symptoms when your family member is diagnosed. Once diagnosed, take the time to get better before going back to daycare, school, or other crowd place. Now I finish my topic. Now I meet you next video.